call the May Public Safety. It's gonna be a great morning. The May Public Safety Committee meeting to order. Let's do roll call.
James Schlender.
Present.
Ron Buckholz.
Present.
Ed Peters.
Mr. Peters is excused.
Dale Schluter.
Here.
Chuck Van Etten.
Here.
We have a quorum.
Madam Clerk, are we in compliance with open meeting laws?
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
The agenda has been distributed. Is there any comments, changes, or modifications from the committee? Hearing none, moving on to public comment. Is there anybody present who's not on the agenda who wishes to address the committee? Is there anybody online that wishes to address the committee?
No hands up.
Hearing no public comment, moving on to number 6, the agenda, our minutes from last meeting. Has the committee had a chance to review the minutes from last month?
I have, Mr. Chairman. I make a motion to approve as presented.
I have a motion for Mr. Buckholz to approve the minutes as presented. A second for Mr. Schluter. Any comment or any discussion on the motion on the minutes? Hearing no discussion, call for a vote. All in favor indicate by saying aye.
Aye.
All opposed? Any abstentions? Motion carries. Going on to number 7, we have the circuit court judge's report. Is the judge available? Judge is not present. We have a courthouse remodel update. Mr. Hoff.
Good morning. Yes, the construction of California Avenue extension is happening as we speak. City is working on that. There's a meeting of the Ad hoc Committee of Public Works tomorrow to interview the construction managers who submitted proposals to our RFP. So there's a team of individuals who will listen to those presentations and select a construction manager, and then we'll get them under contract and then start further detailing the plans for the construction of the courthouse addition.
Any questions for Mr. Hoff on his report? Chuck, you got any questions for Mr. Hoff?
I do not. I'm here now on site for my other job. And I believe they've shut the water off this morning. I don't know if that affected you, but we're marking the lines and everything looks good out here.
Any other comments or questions for Mr. Hoff? Moving on to number 8, clerk report. Madam Clerk, the floor is yours.
Are there any questions on the report that I submitted?
Is there anything we should be looking at that would be of major discussion points?
No.
Any late additions or any other comments?
No.
Any other concerns?
None.
What's your favorite color?
How about you? Yes?
Any questions for the clerk? Any other questions for the clerk? Hearing none, moving on. Thank you for your report.
Thank you.
District Attorney is not present. No report submitted. Child Support, not present. No report submitted. Moving on to number 11. Chief Deputy, the floor is yours, sir.
I have the communication center report. Our dispatch remodel project's been completed. Like I said, if you guys get a chance, stop in, we'll give you a tour. Pretty awesome. There's a little work they want to do yet in the server room, extending some walls and stuff like that. Corey's working. We received the Next Gen 911 grant for a portable 911 system that Corey's working on right now. The project total is $21,185 with the grant covering 60% of the cost. So basically, it's a portable 911 system that if something goes or happens in dispatch, they can grab a computer and run and still be able to function. And work is continuing with North Memorial. They're working on the protocols for the dispatchers. Training will be set up in the near future. The pre-arrival instructions comes in effect at the end of June. So by the end of June, we'll have to have that up and going. Total number of phone calls received is down a little bit for the month of April, but the calls for service of those calls is up, looks like about 200, so.
Any questions for the chief deputy? Lieutenant Rapinski, floor is yours, sir.
You can see we are trending steadily for calls of service to our patrol deputies. We are down a little slightly from last month, and there was an increase from this time last year of 193 calls, which some would think that that would be out of control. There's something really bad going on, but it's actually where we should be trending at. Due to the COVID restrictions last year and the shutdown, that's why we had very low numbers in April of 20. We're also having a couple in-house service dates for training. It affords us the opportunity to train with our partners in the county. We work together, so it's always nice to be able to train and socialize together, and we get some good networking done.
What does that training entail?
We have in-person trainers, which are focused on professional communications, DAT recertification. We also have our state mandates for firearms and emergency vehicle operations courses.
Do you work with the other law enforcement agencies in the county?
Nice we do.
Any questions for Lieutenant Rapinski? Chuck, you have any questions?
I do not, thank you.
Moving on to the Communication Systems Specialist report. Is there any questions for that? I don't know who would field that. Probably the chief deputy, because he's master of all.
Probably Jeff, he's the master of the radio stuff, but
Just working on some, I guess, fine tuning of the system now. We have a team in place that's helping us, a team of patrol deputies in place that's assisting us with this and gathering more detailed information as we fine tune everything. We're in the works of getting the microwave connectivity for all the bandwidth that has to go between the towers. That's in the works with John Crook, and I know Celix has been involved, the manufacturer of the company. And our county IT department has been assisting with that as well. So I guess other than that, if there's any specific questions, I can answer them.
How's our tower at Pipestone,
How's the tower?
or the path there?
I guess that I don't know.
Good,
Good.
really good. Better than it's ever been.
So is it like accessible through normal means, or are we still taking helicopters?
No helicopters needed.
Any other questions regarding the communications report from the committee? Moving on to number D, jail report.
My report's up there, kind of coincide with patrol. Our numbers are down a little bit from last month. Dodge Correctional and TT are both opening up and accepting more prison inmates. Still probably about a third of our jail population is just simply waiting to go to prison. So we're getting as many there as they allow us to. Other than my report that's attached there, I just want to add that Deputy Sonia Sunderland retired after over 25 years of service to the Sawyer County Sheriff's Office and our community. She retired effective last Friday. Deputy Carter Hartwig, who had been part-time in the jail for I think almost 4 years, gone through recruit school and started part-time on patrol with us. Got full-time in the jail and is now in the Huber deputy position. He's trained in that, and also being trained in court services, so he can assist with the added court duties as well.
So is there a plan to replace Deputy Sunderland?
That's Deputy Carter Hartwig.
Okay.
Hartling, Hartling.
And then how is the interaction with Justice Point working out? Is that
Very well. It's still kind of a learning curve for the actual or the exact process that we're doing, but it's getting smoother by the day, pretty much.
Is there a measurement that you can provide that shows Justice Point's involvement in alleviating the jail population?
Not at this stage. There's not. I think 6 months from now that would be.
Yeah, just keep an eye out for that, because that's something that we're going to need. We're going to have to be able to use. Justice Point was brought in for a plethora of things, but one of the major objectives was to alleviate the jail population.
Yep.
So if we can give a measurement for that, that would be helpful.
Certainly.
Any questions for Lieutenant Johnson, Mr. Schluter?
Yeah, speaking of jail populations, you say a third are waiting to go to.
Nearly a third.
Approximately a third.
Yep.
Are waiting to go to state prison.
Correct.
And we have 82 at the moment in our jail.
This was as of the 27th of April.
Okay, so,
We're up slightly from that right now.
okay, but still, a third would maybe 30 less than. So if you take 30 away from 93, that's a jail population of 63. And I don't think I've seen that for over a decade.
It's been a long time.
I think something's working. That sounds like a lot of proof to me.
Any other questions for Lieutenant Johnson? Chuck, you got any questions for the jail lieutenant?
I do not, thank you.
Animal control. Any questions regarding Sherry's report? Are we anticipating her coming back anytime?
She has not mentioned me.
Mr. Chair, just for the record, child support, she did submit a report that didn't get to Lynn. She sent it to the Public Works Committee or Public Safety Committee, so you did get it by email, but we'll attach it so that it's there for future reference, but she did supply something.
Wasn't really concerned. All right, moving on to the coroner's report. In the interest of brevity, there was a question. Our legal department looked at it. There is an ordinance that deals with the question that Mr. Onerheim had raised in the past. And the ordinance actually deals specifically with the questions that Mr. Onerheim had posed to the committee. And one of the specific answers is that the Health and Human Services Committee is the one that has the jurisdiction to hear those kind of issues. And so it is with that we will pass this issue on to the Health and Human Services Chair for their consideration, and this can come off our agenda. You do have a coroner's report?
Thanks.
You wanted to hear that, didn't you, Dale?
Moving on to number 13. Sanchez.
There's my report. The only thing I really want to highlight on is yesterday I drove down to Brookfield and back. I've been asked by the state to assist with the national exercise, the Patriot exercise, and I'll be working with 30,000, I don't know how many people, but 30 different states and multiple counties, fire, law, and EMS in a large-scale exercise in June. So this is part of my requirement in my plan of work, but it also allows me to interact and network with other county entities to see how they handle disasters and other large-scale activities. So it's going to be quite the learning experience. I'm really looking forward to it.
Any questions for Ms. Sanchez? Chuck, you got any questions on the emergency management report?
I do not, thank you.
Thank you for your report. Moving on to number 14, Criminal Justice Coordinating Council update. The committee met yesterday at noon. Justice Point, as was indicated by Lieutenant Johnson earlier, is working to integrate with some of the bond testing and the pre-sentencing issues with, people who are in pre-sentencing, working on the bond testing and providing other services to help address whatever the concerns are. And those concerns from I probably should have wrote this down, but they're working on education options. They're also looking at providing assistance for showing up for their hearings and employment assistance. So Justice Point is actually doing a pretty good job. We're going to integrating the discussion between the public defender's office, the district attorney's office, and then they're also working on a TAD grant. And so they're in the preliminaries of collecting that information. And then they will be the ones that will be I think they're the ones that can spearhead the drafting of that, correct, Stroud?
Yes.
So Justice Point will draft the TAD grant. The TAD grant is something aversion, treatment, assistance, and diversion. And that's a grant that's offered by the state to provide funding for treatment courts and other diversion programs. And so right now there's 95 people that are in the Justice Point operation right now. They were contracted for 50, so they're redirecting some of the resources to accommodate for that overflow. And then TAD grant will include some requests or some other assistance to offset if there's this trend of people being in the Justice Points programming continues. So that's the report from the CJCC. Is there any questions, Mr. Schluter?
That's quite an additional number of people.
It is.
And how's that affecting the budget?
It's right now what they've done is they had there was a component that was supposed to be for diversion, and so they haven't had really an opportunity to work with the post sentencing component. So they're taking that person and using that person for the case management on the pre-sentencing. Because I did ask that same question, and what the committee is going to do is continue with monthly meetings to determine and monitor what that's going to look like, to see what kind of resources are available. Because basically what that resource is that making sure someone is there helping and providing case management for that pre-sentence person. But this was kind of anticipated. We knew that this was going to happen because we've had such a large population participation in the meth issues that were causing people to be charged out and arrested. So it's being monitored. There's no real answer yet. We're hoping the TAD grant, if it comes through, would provide additional resources to deal with what is going to be this ongoing situation.
What we knew they would be overwhelmed from the beginning.
Yep. That's the reason why we also reached out to the tribe. So the tribe's providing some money to help offset that as well. So
I guess I missed that part about being overwhelmed from the beginning.
well, they initially, I think it was, I thought the initial number for potential clients was going to be 30. We asked for that to be increased, so I think it went to 50. And we went through some of when Justice Point first came on board, we had them talk with the tribe, with the judge, with the DA's office to get kind of a handle. So it's a lot, but it's not unexpected. And that's why they're able to reallocate some of the resources to address what was the immediate need. And it's not a permanent fix. It's just an attempt to adjust to what the concern is. And it's monitored. It will be monitored. So we'll see where this goes after that.
Is this a case of if you're stretching your resources that thinly that you're not able to accomplish what you first believed could be accomplished because your resources are lower? One on me, let's say.
I think that's partly true, partly correct. I think the reason why I was asking for a measurement from the jail was what we spend for Justice Point may help us realize savings in other aspects of the criminal justice system.
Well, that was a key reason for getting involved.
Right. And so, but we also knew that, and we knew this even from before we got involved with Justice Point, when Diane McDaniel was there, was we only have so many seats in jail. So the only measurement we really had was what the jail population is going to be. So what we have been doing with Justice Point is coordinating with CCS and trying to get other people to participate in pre-sentencing agreements where they would start treatment now. And I think that's starting to come to fruition because there's a county component and there's a travel component, which that creates a little bit more of a savings, but we don't have a way to measure that part because we need to get Justice Point in place and realizing what they're doing, because they're kind of feeling their way through what they knew what was going to be the issues, but every county has different specific needs, and that's kind of what we negotiated when we spoke with them. So it's an adjustment. I think they've been successful so far. But they're not being successful in the model that they thought they were coming in, because they were trying to, it's getting people through the court system from pre-sentencing to post-sentencing. And our logjam is that our court only has, we have that logjam with one judge, one courtroom, and not being able to process those cases quick enough so that we can get them through post-secondary. So there's a multi-pronged approach to try to address that. What the parts that we were able to address, I think, have been successful in terms of alleviating the jail population, because we've got people out on electronic monitoring. We've got bond testing, which has been kind of like a quasi pre-drug court kind of situation, because they're not adjudicated, but they're under, they've been charged out. So.
Our judges, we don't have any visiting judges coming in?
We have all sorts of judges. The docket is it's like you're having one engine drive a large. It's going as fast as it can, because there's Tuesdays or it's full docket. There's bond hearings. I mean, he's even using court commissioners. Court commissioners have been coming in and handling, in custody hearings and trying to work on it. It's just that it's not just a matter of adjudicating it, but you want, and this goes to the issue why the second courtroom became an issue, is if you have 8 hours of court time in a day, and you have 80 people or 800 people, you need to get through those people in order to process it to the next step of the criminal justice system. So if you have 80 people in your courtroom, well, then you've got a better chance to hear the issues that are affecting that person, and addressing their constitutional concerns while also addressing what their crimes are. If you got 800, you've reduced that amount of time, and so now they're processing it where it's just automatic. It's just snap, 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 and you're going through. So a second courtroom will help alleviate that, so they can better allocate what their resources are. What Justice Point is addressing is what would have been the overcrowding component of what the jail would have been, because we had at one point we had like 15 or 20 people that were outside of the county incarceration, and so that was so backed up. I mean, probation holds were pretty severe, and so as we adjusted that, we're able to move that. But now we're in the second component, which is the courtroom, which then will help us get to the third component, which is the drug court and the treatment center.
You could have just said, yes, we still have visiting judges.
All right.
I like the info, Mr. Schindler.
Try my best. I was trying to be concise. I know I was getting a little bit weird there. So, all right. Any other questions? Chucky, anything you wish to add? Are you still awake?
I am. I'm good. I don't have anything to add.
All right, here we go. Going on to, well, we got a little bit of hiccup here.
Yep.
15 is future agenda items. Do we have anything we want to add to next year or next month's agenda? There will be an update on the court model remodel, because there's a meeting tomorrow. All right. Well, if there's something that pops back up, don't be afraid to bring it. Going to number 16, ambulance report. Mr. Dunstan.
All right. So staffing, right now we have one open paramedic and one open EMT position. We have a class that's ending. They'll be testing in June. So we're hoping to get some good candidates from that class. I've heard some people asking from that class, how do they apply, and where they apply to get for employees. So that's actually pretty exciting. We do have one new EMT that's accepted a position with us. She will be starting the week of the 16th, and she'll start going through orientation. Billing company is still a work in progress. They're still trying to get through all the old claims and then work our current stuff. From what I understand, they have 3 different billers that are currently working everything for them, since we have so much that was old with the previous owner.
How soon do you think they'll be caught up?
I don't know. You?
Well, it's, as Nate said, it's a work in progress. They're working at it. They got 3 people assigned to it. It's going to be, months, not days, to get caught up.
Now we have been saying this for a long time, right? Hey, work on the old, everybody knows here. But like I said last month, we're actually seeing the checks coming in that are old. So this gentleman, this new owner of this company does seem like they're actually doing what we've asked them to do. So we do have that. I did ask Mike the other day where we were on budget for this year, 2021, on revenue, and he said we have no budget, or we're making it right now. So, you know, it scares me a little bit because you would think when you have a lot of this old stuff coming in, you should be hopefully a little bit more above budget. So, but that's what Mike had said. We are also working on a new inventory system. Currently, we have a rig check system that we use electronically. The company came up with a new module for inventories. So hopefully that'll help streamline, make sure we don't have a whole bunch of extra stuff, and hopefully help with our supply ordering a little bit. With supply ordering, our glove allocations have been lifted. So Boundtree, one of our big suppliers, did say that, you know, they're starting to get stuff that was backlogged in. So hopefully this COVID thing is kind of, you know, they're back on for supply. Because we're kind of releasing some of the stuff, we are actually starting up our monthly staff meetings, monthly trainings in-house. We've always done it down Stone Lake because Stone Lake Fire Department has been so gracious to open up. They've got nice big room to get most of the people. It's kind of, we can get both crews there if we really, really need to kind of staff. So they're going to be meeting on Saturday. This month is kind of about trauma with the summer coming up. So we're going to brush up on some trauma skills and assessments and different items, and that's Saturday at 1 to 3. We also have that pre-hospital trauma life support I know I've talked about the last couple months. That's going to be this month in Stone Lake, and that is totally paid for by the RTAC, the Regional Trauma Advisory Council. So we're trying to fill as many people as we possibly can. So we don't pay one thing for it. It's 1 day for 8 hours. We're also going to send it. We're not going to send because it's all remote. But we're starting a new pediatric system. It's reference, different equipment, stuff like that. We're pretty excited about it, and that's called the hand heavy system. But we have to have internal people to teach it. So we're sending 3 people, you know, remotely to take that class, and they'll teach everybody else in-house. EVOC, emergency vehicle operators course. We are sending 3 employees that weren't able to take it this last time that we did it last year because they're new. That'll be in Rice Lake. EMS week, I just want to kind of touch base a little bit. So if you see anybody in EMS that's out and about, EMS week is May 16th to the 22nd. Talked a little bit about regional stuff. Barnes Ambulance just recently got a new ambulance director. Their last ambulance director and fire chief stepped down because he took the town board chairman position. And he also accepted a new position at WATC for teaching. What shouldn't really affect us too much. Actually, I'm hoping it even makes the relationship better because the new ambulance director is actually an employee of ours. So that is Brett Braden. And then Birchwood Ambulance. I'm going to go down to their next meeting, I believe, which is next week, Wednesday. And the only reason why I'm going to is because we had talked about Edgewater. Edgewater has always kind of come up that, you know, it's the one township that we don't cover in Sawyer County. Edgewater did sign or gave notice that they are going to be removing themselves from Birchwood. So I just want to kind of see what the 411 is on that because they haven't come to us since last year when they were kind of talking about it. So, and I don't know what that will look like for Birchwood's district. I know that Cedar Lake Township, which is McConna, has also put in their notice too for moving out of the district. So again, more EMS drama to the south. So otherwise, I am going to update Lynn on the call volumes. We are a little bit in a lull right at the moment. However, we're all preparing because we've all been told that this summer is going to be crazy. So it's going to be calm before the storm. And then the only other thing, no, it just lost me. Oh, I did attach In my minutes, a PHTLS pamphlet, just so you guys could, if you wanted to, if you're interested, you could see what that is actually about and different things for the class. It's pretty exciting up here. And then I did attach a thank you letter that had come, or a card that had come from Russ County Memorial Hospital from their executive committee, thanking us for helping them with their patients and moving their patients out. So other than that, that's all I have. Thank you.
Any questions from Mr. Dunstan? Mr. Schluter?
If those communities are detaching themselves from their current service and they're still in Sawyer, and they are in Sawyer County, we're just going to have to expand to service them.
Yes, now you have to also remember that they do pay for ambulance services in
I
Sawyer
know,
County.
I
And
know.
that was one of their big pushers because Birchwood upped their tax or their, whatever you want, their charge to cover them.
I've wondered for years how we were getting by with all this.
Right. Now, the only thing that I will say, it's going to be, and I've told Tom this too, it's going to be a little bit of a nightmare strategically to get down there.
Yeah.
And that's the unfortunate part. But when we met with Edgewater, the chairman of chair people of Edgewater town board, we did tell them that, and they did understand that. So they just said they can't pay anymore.
Well, they should just pay what they've always been paying in Sawyer County.
Right.
But they're entitled to the same services as everybody else in Sawyer County.
Yep.
This could mean having a station in ambulance down there, could you?
I don't know. We kind of, for the Gordon Township, when they were talking to us in Ashland County, we had gone to this 3 trucks staffing type of ordeal where we have a 3rd truck for 12 hours, 6 days of the week. And there's 2 of them up here. That was kind of maybe the idea that maybe if we have to, maybe we will move that during the day down to Stone Lake, because it can go anywhere wherever we need it. But we haven't seen what the summer looks like yet up here. Our expectation is that truck's going to really help alleviate a lot of the call volume in Hayward, or like transfer requests or whatever else that comes in, so we don't have to backfill as much. But I mean, that is another option that we can do, is we can send one of those crews down at least 12 hours a day. I think, if we have more issues with volunteers, volunteerism has always been declining. I think the county will probably end up moving to 3 trucks 24/7. Is that in Hayward? I don't know, we'll have to relook at it. But, I think that's going to be probably the long-term goal here.
Okay,
So there are some different things.
we know that.
Yep. But I do.
Finance needs to know that next year.
Right.
Will be more expensive for the ambulance.
Right. Now, I do believe that Birchwood District had a clause that if any of their members, any of their towns or whatnot, want to leave, I believe it's a 9-month notice. So, too.
They may or may not require that.
Mm-hmm. Yep. So they did put their notices. Both of those 2 townships did. Are one. So, but they haven't come back to say anything. That's why I want to go down there and sit in the corner and ask Pete Baraboo and them and go, hey, what's your thought?
I suspect their thought is going to be pretty much we want an ambulance down here.
But they have talked about that too. But I mean, they're also looking, long-term down there, they're looking at building a new fire department and ambulance garage and everything else in Birchwood, the village of Birchwood. And their big issue, their big concern right now is, do we build this when our members are leaving? So I know when I talked to the ambulance director down there, Vince, he did say that, that's probably the big kicker on that, is that they'll probably not build that. And their district, their new chairperson on their district had said they're going to look at maybe putting the ambulance from what was district and see if the Birchwood Village will actually take back of ownership on that ambulance. And when I asked him, I said, is Birchwood okay with that? And he said, I don't think so. But, these are, again, newer elected members on this board too. So
Well, I wish them luck.
I don't.
Any other questions for Mr. Dunstan? Chuck, you got any questions on the ambulance report?
I do not.
Thank you for your report, sir. Moving on to number 17, correspondence reports from conferences and meetings and other matters for discussion only. Is there anything else that the committee would like to discuss at this time? Chuck, you got anything you wish to add?
No.
With that, this meeting is adjourned. Thank you, everybody.